I think the crisis we are facing in Borno affected the health sector in one of the worst ways. Let's start with our infrastructure. We have a third of our health facilities destroyed. That's about 240 something plus. Those facilities were rendered not functional. Either they are burnt down by the insurgents or they become dilapidated because populations have moved out of that area or vandalized. Then we have a lot of health workers in those health facilities that have fled those areas. We have some that even lost their lives. Then after the insurgency, even when those places are opening up, some of the health workers are not too keen to go back to those areas, and this presents one of the major challenges to us. So also other health support infrastructures, offices, cold chains, stores and everything. A lot of those facilities were also affected. The first thing actually is to strengthen those existing health facilities to be able to cope with the number. So we mobilize more health workers to those places, especially those ones that were displaced from other places. So what the Primary Healthcare Development Agency did was to set up clinics in all the IDP camps to provide integrated PSC services. We need to go further to collaborate with other partners to get supplies, to support with the human resource gap. And that is how all those IDP camp clinics come into existence. It's just to address this health challenge gap that was brought about by the insurgency. Of course, you have to start rebuilding back only in those areas that are safe to return or they are not at risk of being destroyed again. If you have come by road from here along Damaturu Road, I think there are about 3 more health facilities that were built that were not existing initially. Those ones are in Auno, in Jakana, in Makintakurori. All those are settlements that are now safe, and people from the hinterland are coming to settle in those places. So new health facilities were built in those places. And also the local governments that are just opening up now. Some of the health facilities that were destroyed, we are not only rehabilitating them. Some of them are completely knocked off and then completely rebuilt. Nutrition, reproductive and family health services, maternal health services, immunization and all the rest form the component of the basic primary healthcare services that are provided. And this is the package that is existing in all the IDP camp clinics. Now those places that are inaccessible, there is little you can do. So we have those health camps and health clinics in those IDP camps where we believe if people were evacuated or they escape from these insurgent places, this is where they're likely to camp. So immediately a camp, an IDP camp come into existence, we rush to set up that service point that will provide these integrated services. It's very bright because we are coming out from one of the most challenging situations. The agency itself is created in the middle of the crisis, sometime in 2013. So we just hit the ground running. So there are a lot of lessons learned. Then we do a lot of, we have a lot of resource persons coming from different parts of the world, different parts of the country to give their input to our strategic planning. And then the government is also tracking very closely to see to this response. We all believe that yes, we have been left so many years behind because of the crisis. So there is this zeal to catch up. And then this coordination has brought not only the partners together, but all the government agencies, where to come up with health facilities, what rationale, we have a plan to follow. So I believe in the next couple of years we are going to catch up.